Shalom and welcome to 2 Minutes of Torah. This year is entitled On Death and Dying. Which interventions must be employed when someone is at the end of the road and there's no hope, no cure, and which ones can be left alone. So in Shin Lametet Yoredeya, a famous Ramah talks about if the person is dying, you can't move the body in any way, you can't do any act, like put something under the pillow if you think that's going to hasten his death. If there's a wood chopping going on outside and you think that's keeping him alive, you actually can ask the wood shop to stop. The Nishmat Avraham on Yoredeya Shin Lametet quotes Shlomo Zalman Auerbach and says the following: the person's at the end of the road, there's no hope medically, no cure, cancer ravaging the body. He says he must differentiate between routine care, basics, oxygen, drip, basic sustenance, versus extraordinary measures. So the first former category, you have to keep going. You have to keep the oxygen going, keep the drip going, keep the basic sustenance going. Extraordinary measure, such as a surgery that somehow is going to keep him going for a couple more days, but it's not going to cure him. It's just going to be more pain and misery. He says that you are not obligated to do it, especially if the person is alert and says, I don't want it. I don't want it. So we do not say, you have to prolong life no matter what. It's not true. He differentiates between basic shigra, routine care, and extraordinary message. Of course, we are assuming A, that there's no cure, there's no hope, and B, it's just going to be pain and the person doesn't want it. A lot of other variables involved. Of course, this little discussion is just to give a little bit of an overview of the topic. Halacha l'maaseh, if this ever applies. Of course, one must talk with the family post-sing. Yoshe b'sra tovat.